Do we have any questions?
I see one in the chat. Do you want me to answer that one, or you want me to read it?
Yeah, that would be great.
Okay. She asked, when do you add Juice Plus to a toddler's diet? And the answer is you don't want to rush it. I'm assuming that we're talking about a gummy, or are you talking about the powder? And you can do either one. And a lot of people today are, when a baby is somewhere between 6 and 8, maybe 8 and 10 or 12 months, they're just opening the capsule, putting the powder on a saucer, and just wetting your finger a little bit, and then just getting a little bit of powder, and then sticking that in the baby's mouth and let them just kind of suck it off. But as far as adding the gummy, we usually wait until about a year and a half, or about 14, 16, 18 months. But when they're tolerating table food, and a gummy is pretty big, the soft chew. So I would cut them up so that you don't worry about them choking themselves. Just whatever they can chew. Typically, you wait until they have some teeth. But by the age of 2, most children can easily tolerate and handle Juice Plus. Another option is to take the powders and make a very dilute smoothie and put it in a baby bottle and let them drink it out of that, or a sippy cup, something like that. The thing that you don't want to do is you don't want to give them too much too fast. So err on going slow. It's kind of like when a child is 6 or 8 months and you start table food, you usually start with something like applesauce, something that's generally very well tolerated, or maybe cereal, or some cereal with a little bit of soy milk or almond milk or something like that. Make it a little diluted so that it goes down a little easier and they don't have to do a whole lot of chewing. But you wouldn't give them 3 or 4 or 5 different foods that first week. You give them one and let them adjust to it. You give them another one several weeks later and let them adjust to that. So just introduce one food at a time, typically. So that's why when you're offering Juice Plus, whether powder or chewable, you're looking at 10 foods or more. So it takes a little longer for them to get acclimated to it. So just err on going slow.
Great question. Great question. And good. I love that answer. Gave me some things to think about. Who else? Who else might have a question? Here we go. We got some more, Dr. Odom.
Okay. Would Juice Plus ever be considered unsafe, or ever be unsafe to recommend to a pregnant mother? In my opinion, only if she's had an anaphylactic reaction to one of the foods. Other than that, because it's balanced, it's a small amount of many different foods and not a large amount of any one food. It would be safe for virtually anybody else.
Infertility.
Oh, infertility and Juice Plus. I don't know how or why, but early in my career, I was the premenstrual syndrome doctor, because I figured out a way that I could help women juggle their hormones and have some relief from that. And then later on, I've seemed to be the doctor, even though I didn't have special training for infertility. But I saw a lot of women that came to me who had seen other doctors, or who had moved to Jackson from another state or town, and they had had testing. The testings were generally normal, and that means on the male as well as on the woman. And when they would come to me, and I would say, well, it looks like your tests are normal. I think it's really a matter of time, and would help to try to really reduce anxiety and stress in their lives. And but it was amazing how when we added Juice Plus, we had a large percent of people that are infertile. Even 20% or 15% would be pretty remarkable. But there for a 6-year period of time, we went back and looked at the ones that came to us specifically for that, and we had over 40% fertility rate after they added Juice Plus, and most of those conceived within the first 6 months to a year. So I have no idea what was missing in their diet, but something was in there that just made their body more applicable to a condition called homeostasis, which is where everything in the body is just in balance. So the more that we can move toward this state of homeostasis, the more likely they are to conceive. And it was pretty much a given that it wasn't just the woman, because studies have been shown that half the time it's a male factor and half the time it's a female. But unfortunately, women get blamed. Well, if she couldn't get pregnant, well, it takes two to do that dance, and we know that. So we would insist that if she's serious and to correct her nutritional deficits, that he needed to do the same thing, that and add Juice Plus to his diet.
Another good question there. Thank you, Kathy. Anyone else? We'll let Dr. Odom. You've shared so much of your time. We're so appreciative. But does anyone else have any questions?
Okay, well, first off, let me say I'm not sure I would want to talk to doctors. Most of them are too cool. Juice Plus takes too long to really affect a change. They know everything. They're a doctor. There's so many reasons why I really, if I have a personal relationship with the doctor, or I'm telling you, if you were to walk into the grocery store and you saw your doctor and they called you by name, well, then you have a relationship with them. But if you just, and I've had patients and other people, non-patients, leave information at the desk for me to look at, I probably wouldn't do that. But if somebody asked me to, I probably would. But when I would be seeing a patient and I would talk to them about Juice Plus, and I could tell that they were seeing that it was that they were interested in what I was telling them. And so oftentimes, especially when I wasn't seeing just pregnant women, and they would say, "That's great, but let me ask my doctor what he thinks." So they were really saying, "Let me ask my endocrinologist, let me ask my cardiologist, let me ask my internist." And I'm thinking, because when they said, "Let me ask my doctor," and I said, "Well, your doctor just told you." But that's what they were saying. But I would say, well, if you talk to your doctor, I would encourage you to always get a second opinion, or a third one, or a fourth one. Ask until you get your questions answered and be comfortable with the answer. And you can always just go from doctor to doctor to doctor until you get the answer that you want to hear. But that's not really why you're paying them. So listen to what they have to say. But when they would say, "Yes, let me ask my cardiologist what he thinks," I would say, "Well, great. Just do me one favor. don't ask them about Juice Plus. Don't say, what do you know about Juice Plus, or what do you think? Or even if you had information and you gave it to him, he's probably not going to take the time to investigate and evaluate. But I would say, ask him this way: Doctor, I'm thinking of making a serious change in my dietary intake, or in my lifestyle, in my nutrition. Do you think it would be a good idea if I increased my consumption of a variety of raw fruits and vegetables and berries? Do you think I need to eat more of those? Would that be a good thing? And I would say, and if he says no, I wouldn't worry about it. Just continue to eat that sloppy diet that you're on, and then see how that works out. If your doctor says something like that, it's time to get a new doctor. So, but because most doctors wouldn't take the time, or if they had heard about it, they really didn't know what it was. So just ask it in that way, because that's what every doctor should be telling their patients. The doctor should take his time, her time, and educate their patients. Nutrition is important. We're finding in 2022, it is so much more important than it was in medical school in 1965, or in 1980 in practice, or in 2000, or even 10 years ago. We know today so much of our health is determined by what's going on in our gut. And when Caitlin was talking about her taste buds and the baby's taste buds and nutrition and all of that, it's not just the taste buds, but it's the enteric microbiome. It's that bacterial balance that determines your gut health, that determines your immune health, that determines your mental health, that determines so many things, because they're so intricately connected to what's going on in the gut. So if we can fix the gut, if we feed the good gut bacteria, you're going to cure an awful lot of things that are wrong in this country today with the physiology of our population.
Wow, that's so powerful.
I think you've got a couple more questions.
Sure.
Let me.
Claudia wants to know, can a pregnant woman take prenatal vitamins and Juice Plus?
Sure, I saw that, and I was going to try to come back to that, but I forgot to. But yes, in fact, I never told a pregnant mom, or a wanting to be pregnant mom, to stop her prenatals. That is still the standard of care in 2022. So I was not deviating from that. But I would say, any more than that mom that's on prenatal vitamins, I would encourage every one of them to stop eating the junk food, the sugar, the calories, the processed, the gluten, and the dairy especially. So just it's as if when you're adding Juice Plus to a pregnant mom's diet, it's like adding more tomatoes and spinach and broccoli. It's a second helping of that every day. And so, but patients would say, but am I going to overdose on all these vitamin things? And the answer is no, because the prenatal vitamin doesn't have that much that would cause you to really overdose or have a problem. And the beautiful thing about eating food, this human body that we have recognizes food and realizes when our antioxidant stores for, say, vitamin C are full, you don't need any more, so you'll stop consuming it if it's in food. But if it's in a vitamin, you can definitely overdose a lot of things, and especially those fat-soluble vitamins.
Can I add something to that really quick? So at 37 weeks pregnant, you don't have a lot of stomach room to want to eat. So I have been struggling with lack of appetite, and was just talking to my midwives this morning about it. And my midwives know that I take Juice Plus and that I drink our complete shakes. And we didn't touch on that today, but my midwife encouraged me to drink as many complete shakes and or perform shakes as I could during the day, and that be my main source of nutrition, because they're light, they're easy to get down, and because she's seen the packaging and knows that it's great for me to take, and that there's no risk of overdose or harm to the baby. And so I think that is something that's really helpful for moms when you get towards the end of pregnancy, or even in early pregnancy when you don't want to eat anything because you're nauseous. Those complete shakes, the chocolate complete shakes mixed with coconut water, got me through my first trimester with all of my kids.
So why would she tell you, this is rhetorical here, why would she tell you that that's great to drink those shakes? That's a protein powder, and especially the Perform. So, but can you eat too much of this protein? And the answer is you cannot eat too much plant protein. You can absolutely eat too much animal protein. Animal protein is typically and specifically inflammatory, especially when you are consuming a lot of it. With plant protein, it reduces inflammation. It's anti-inflammatory. So that's your answer right there. Can you overdose that? No, you can't. And it's not just protein. There are other things in there, and especially the Perform. Those are B vitamins that are added. Those are the methylfolate. That's exactly what we need to be consuming in our green leafies in the first place. So everything that's Juice Plus is absolutely beneficial in a pregnancy. There's not a single thing that is a negative to a mother or a fetus.
Another question says, other than the University of Mississippi research study, do you know of any other studies related to benefits with Juice Plus in pregnant women?
Juice Plus? No. As far as I know, there's not another Juice Plus study on pregnant women. I wish there were.
Sure.
I think when our study was done at the university in the early 2000s, the managing nurse was offered Juice Plus for her. She was a single mom and her son, and she said, no, thank you. I don't think we need it. I don't think she was a staunch believer in what it was. And the research is based on consistency and the patients doing this, consuming this every single day. That's where the magic comes. When you do it haphazardly, you're not going to see the kind of results that I did in my practice. You've got to stay on top of them.
That's good. Another question is, my daughter's allergic to soy. Can she take the shakes?
That would be determined by trial and error. Most soy that's grown in this country is genetically modified soy. I would not eat that. If you go to a Japanese restaurant, you eat edamame, I would not eat it unless it's organic, non-GMO soy, and you're not going to get that in most restaurants. It'd be too expensive. So the soy that we have is completely different. It is minimally processed, or it's minimally altered. And in my opinion, it's one of nature's most perfect foods. Soy, it's one of the few foods that has all of the amino acids, all of the essential amino acids. Quinoa is another one. And I know another one too, but there are not many foods. But these essential amino acids and essential vitamins, they're not critical for life. Essential means that our body can't make them. We have to get them from an exogenous source, and that's from our diet. So it's great when you can get all of those amino acids that you need from one food. Soy also is a SERM, an estrogen. It's a selective estrogen receptor modulator. For any of you that have a friend that's had breast cancer, they usually do surgery and then chemo or radiation or both, and then they'll put them on an aromatase inhibitor for 5 years. And tamoxifen is one of those. There are multiple others, but what that does is it affects the breast tissue in a way that it blocks estrogen receptors in the breast tissue. Well, that's selective. At the same time, that medication increases the proliferation of endometrial cells in the uterus. So it leads to an overgrowth or hyperplasia of the uterus. and it leads to potential uterine cancer. So whenever somebody would come to our office, we would do a sonogram of their uterus. And if they had a thickness above a certain level, like over a centimeter, we would do an endometrial biopsy. And very, very often they would already have changes, early changes of hyperplasia, which is a precursor to cancer. So, but it's selective. Soy has positive effects in the breast and the uterus.
Wow.
So that's another reason why soy is so effective in Asia, especially Japan, in preventing breast cancer. They have the lowest breast cancer rates in the world, and they consume the highest amount of soy in the world. So they come to the United States and they get on our diets over here, and within a decade, their risk is exactly what it is over here in America.
Wow. Because our soy is processed, most of it.
Because it's not the same soy. That's correct.
Another question says, I've also done research on okra water and its benefits for the mother and baby. One of the main benefits is being smoother labor and delivery. Could you possibly confirm okra having essential vitamins and minerals for pregnancy? Is that something you've heard?
Well, I love these kind of forums that we have, because I learned something too. That's the first I've heard of that, but sounds good to me. But I can't comment. I don't know the first thing about okra water, but sounds good.
That's great. And another one says moringa contains all essential amino acids as well.
Okay. I've heard of moringa, but I don't know that for a fact. I can't comment there either.
Okay. I think we got all the questions now. Wow, this is such a gift, Dr. Odom.
My pleasure. My pleasure. I'm happy to be with y'all, and thank you, Elaine, for asking me, and thank you for offering. And we're close to coming to a date that maybe it works into your schedule. In fact, I wrote it somewhere, so
just send it to me. I'm happy to. Hopefully, it'll work.
May the 26th. It's a Thursday. If you want to think about that, you can let me know. That's the one date that they came up with, and if that doesn't work, we'll find another one that's good for you. Thank you.
That sounds great. Thank you again, Dr. Odom.
My pleasure. My pleasure.
Time.
Thank you.
Caitlin, for you, knowing you could go to the hospital tonight to have a baby. Thanks for giving up your evening with us too, and everyone who joined us. So thanks again. Have a great evening, and we'll talk to y'all later.
Thank y'all.
Bye, everyone.
My pleasure. Thank you.
Thank you.